Hello, my dear nursing aspirants. Welcome you all to the Master Nursing classes. In the last class of the ECG, that is the basic of the ECG, I have discussed the most of the important thing as a basic of ECG, where all nursing aspirants should know before going to the exams. As I told, there are 4 to 5 questions which arises out of the ECG, and ECG is a very important and small important topic that everyone should cover before going to the exams, right? So I had told how the examiner will distribute the marks from the ECG. From the very basic of the ECG, 1 to 2 questions will come, and from the practical portion of the ECG, 1 to 2 questions will come. That is related to the chest lead application and other things I have explained. Then most of the important I have told the 1 to 2 questions there may arises from the interpretation of the ECG, like which one is the tachycardia, which one is the bradycardia, like. Okay, so here I will give a very basic and important thing, and that best knowledge that is very much necessary to you all to interpret the ECG very easily, right? So we will start the today's class. ನಾವು ಇವತ್ತಿನ ಕ್ಲಾಸ್ ನ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ. ನಿನ್ನೆ ಕ್ಲಾಸ್ ಅಲ್ಲಿ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗಿರತಕ್ಕಂತ ಬೇಸಿಕ್ಸ್ ಬಗ್ಗೆ ಕಂಪ್ಲೀಟ್ ಆಗಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿದ್ದೆ. ಇವತ್ತಿನ ಕ್ಲಾಸ್ ಅಲ್ಲಿ ಕೂಡ ಕಂಪ್ಲೀಟ್ ಆಗಿ ನಿಮ್ಗೆ ಬೇಸಿಕ್ಸ್ ಪ್ಲಸ್ ಅಡ್ವಾನ್ಸ್ ಕಡೆ ತಗೊಂಡು ಹೋಗ್ತೀನಿ. ಓಕೆ, ಸೊ ಇನ್ ಟುಡೇಸ್ ಕ್ಲಾಸ್ ಆಲ್ಸೋ ವಿ ವಿಲ್ ಡಿಸ್ಕಸ್ basic plus advanced questions, so that is most important for our upcoming exams, right? So let us start our discussion. And who all are live to the session, please hit to the like button. Please press on the like button, and if anyone is watching the master nursing classes first time, so please do subscribe to the channel. And we have very beautiful WhatsApp groups, WhatsApp channel, Telegram groups, where the 1,000+ aspirants are enrolling and discussing their questions and clearing up their doubts. So if anyone is interested, you can join to our WhatsApp group also, Telegram group also. Okay, I have given the link in the description box. Yes, I'm waiting for your response, guys. Is that wise? Everything is clear? I think so, right? Yes, we will start the class. All are live to the session, please hit the like button. We will start the today's class. Yes, a very good evening to everyone, and who all are got selected in the CRE exams. Many congratulations from our side, and who all are got the rank more than 500. So please do continue your study, because we have the best portion in front of us. That is CRE exams. Sorry, that is our NOSET 8 exams, right? So don't waste the time. Don't be in the depression. Don't waste your time and don't be in the depression, because it is the time to boost up yourself, right? Yes, we will start the today's class, bacho, with a beautiful motivational quote. That is, mindset is what it separates the best from the rest. If you are having the positive mindset, it will give such a group where the all positive results will come. And if you are having the negative mindset, it will take you to such a group where the all negative mindset will be there and negative results will come. So stay positive, keep your mindset completely positive, because it's the time to boost up yourself and study a lots of the thing for the upcoming NOSET exam. Don't be in the depression. Okay, it's just a part of the aspirant's journey. Okay, believe me, students, from your journey, beginning of the journey to till the success, only memorable days are your this journey. Okay, only memorable days will be this journey. Even after getting a success, you won't be that much happy person. Okay, when you remember your old journeys, that is only a lifetime motivation for you all. Okay, how you came from, how you have started, and how you have achieved that one, that is going to matter. Okay, so don't get struggle in every situations. Try to enjoy your preparations. Try to prepare with a good content and good mindsets, so that will help you to get the good ranks in the exams, right? So if you want to come out as a best from the rest, so try to adapt to those content where you are getting the quality, right? So without wasting the time, we will start the today's class, bacho. Here is the first question in front of you all, and I'm waiting for your answer in the comment box. Right? The question is very simple. What is the duration of the one small box on ECG paper. This is very basic. Yesterday only I have discussed that this is the large box. In single large box, there are 5 small boxes, right? One large box is containing the 5 small box. And the question is related to what is the duration which is taken to cross a one small box. What is the duration of the one small box? And yesterday I have told that one we will check the amplitude on the y-axis, means height or the amplitude on the y-axis, and we will check the duration on the x-axis, right? So this is the duration of the ECG, how we have to check on the x-axis, and this is the amplitude of the ECG, how we have to check on the y-axis, right? So it's important. Now tell me the duration of the one small box. Yes, almost all of you people have given the correct answer. There is a 0.04 second is the a duration for crossing the one small box if the ECG is running at the 25 mm per second. So this is the standard ECG paper speed I have told in the yesterday class. Okay. So what is the standard ECG paper speed? 25 mm per second is the standard ECG paper speed. If the ECG paper is running at this speed, means it will cross a one small box in 0.04 second, and if it is crossing a one small box in the 0.04 second, means it will cross a one large box in the 0.2 second, or we can say 0.20 second also, right? So as all of you know, it's a simple mathematics. We can say write this one as 0.20 also, but after the point there is no value for the 0, so we can write this one as a 0.2 second. How, sir? It's very simple. As I told, one small box is crossing in the 0.04 second, means how many small boxes are there in the one large box? Yes, 5 small boxes are there in the one large box, right? So make a 0.04 into 5. Okay, it will give a 0.20 second or 0.2 second. Okay, so to cross one small box, to cross the one small box, 0.04 second is required, and to cross the one large box, 0.2 second is required, right? So this is to cross one single particular box. And the most important thing all you people have to know here is, for 1 minute, if ECG is running at the 25 mm per second, for 1 minute, how many large boxes it will get crosses? Yes, can anyone wants to answer for this one? In 1 minute, if the ECG paper is running at the 25 mm per second, so how many large boxes it will get cross? Yes, that is important. And one of our students given the correct answer, 300 big box. It will get cross in 1 minute. Okay, 300 big box means also we can write in 1 minute 1500 small box. Students, this is a basic. It helps you to solve the calculation of the heart rate by reading the ECG paper. So that is what I am telling the basic here. Okay. So for 1 minute, how many small boxes it will cross? It will cross 1500 small box, and in 1 minute it will cross the 300 big box. But simple ಇದೆ, right? So the standard speed ಎಷ್ಟಿರಬೇಕು 25 mm per second ಇದ್ರೆ ಇದಿಷ್ಟು ಕ್ರಾಸ್ ಆಗುತ್ತೆ. ಓಕೆ, ಸೊ ನೆಕ್ಸ್ಟ್ ಕ್ವಶನ್ ನೋಡಿ ಏನಿದೆ. ಐ ಹೋಪ್ ಆನ್ಸರ್ ಅಲ್ಲಿ ಕ್ಲಿಯರ್ ಆಗಿರ್ಬೇಕು ನಿಮ್ಗೆ. ಸ್ಮಾಲ್ ಬಾಕ್ಸ್ ಅಂತ ಕೇಳಿದ್ರು, ಸೊ ಆನ್ಸರ್ 0.04 second ಕರೆಕ್ಟ್ ಇದೆ. So this is for the big box, right? This is for big box. To cross one big box, so how much time to be taken by the ECG? So that is the 0.2 second. It's the important thing, right? So here is the next one. Here you people will understand why I have told the very basic in the last question. Okay, the question is very simple. If there are 3 large boxes between the R waves, between the two R waves, on an ECG, what is the heart rate? Okay. So if there is three large boxes between the two airways in an ECG, so what is the heart rate? Calculate the heart rate now. Sir, how we have to calculate the heart rate? Just now only I have told heart rate to be calculated per minute, right? So how we have to say? It's on 60 beats per minute, 65 beats per minute, 75 beats per minute we have to calculate, right? So here the given the large boxes, right? So for 1 minute, how many large boxes ACG paper is crossing? It's crossing 300 big box, right? 300 big box it is crossing, right? So, and they have given three large boxes between two R waves. So, for one beat, right? Look at this image, so you will come clear idea. From here to here, one QRX complex to another QRX complex, this is what we call as the one beat, one heartbeat, right? So the duration between the one heartbeat, we can say, or the duration between the two R waves, right? So that is the one big box, two big box, three big box, four big box, five big box, six big box are here, right? So, but in the question they what they have given three big boxes, right? So the distance between the two R waves is our formula, right? So how many boxes are there between the two R waves? So that is the three boxes are there in between the two R waves, right? So why? Because they have given already in the question, right? They have given already in the question. So now what is the heart rate? That is simple. 3 1 ja, 3 10 ja, 100. So our heart rate will be 100 beats per minute. It's simple and important. Okay. So examiner may throw this kind of questions in front of you. So it's very simple. So if there are large box, keep 300 big boxes divided by the number of the large boxes between the two R waves we have to mention here. Okay. So this is the standard formula. Okay. Heart rate is equal to 300 big boxes divided by number of the big boxes between the two R waves. Right. So this is the standard formula. Okay. So by using that formula, calculate this one and tell me whether it is the bradycardia or tachycardia. Yes, use that same standard formula. This one, 300 divided by the number of the large boxes between the two ROs. Yes, it's very simple. Bacho, look at this one. This one is the one big box, second big box, third, fourth, fifth, sixth. So total six big box. Total how many big box are there? Total six big box are present between the two ROs, right? So the six big box means we can say heart rate is equal to 300 divided by the number of the big box between the two ROs are the 6, right? So 6 1 ja, yes, 6 5 ja. So 0 remains here. The heart rate is equal to 50 beats per minute. 50 beats per minute. So here one basic all you people have to understand. Normal heart rate is, all of you know that, 60 to 100 beats per minute. So this is the normal heart rate. And here ECG is showing 50 beats per minute. So it indicates it is the case of the bradycardia. Okay. And we have already mentioned the answer, that is the bradycardia. Right. So when we will see the ECG paper and someone will ask you whether it is a bradycardia or tachycardia, means what you have to see, you have to count the number of the big box between the two R waves and divide that number, take this, that one as a denominator number and divide to 300. Okay. So heart rate is equal to 300 divided by the number of the big box between the two R waves, right? So similarly, if the examiner given the question with a small box you consider, right? So you have to use this one because 300 big box is equal to 1500 small box. Why? Because why like this? Yes, I have told this is a one big box means here we are having the five small box. right? 1, 2, 3, 4, 5. Okay, so one extra came here. Remove this one. Okay, so just know the theory, that is very importantly, one big box is equal to 5 small box. Similarly, it's crossing the 300 big box per minute. It means it is crossing the 1500 small box per minute. It is simple. Why? Because one big box is 5 small box, means 300 big box is 1500 small box. Okay, so here very importantly, if you are taking 1500, means that is in the denominator you have to count a small box number, okay, between the two RVs and divide it one. Very simple. Take example, if examiner given, so there are 15 small box between the two RVs. So what is the heart rate? Simple. 1500 number of the small box between the two RVs are the 15. So 15 1 ja, 15 1 ja. So that is the 100 beats per minute is the heart rate. Okay, so this is very basic and important thing, right? So let us calculate same here. So this is the one R wave, second R wave. Okay, so this is R wave. So count the number of the large box between the R wave. This is the one box, two box, right? So only two large boxes are there between the two R waves, right? So here how we have to calculate, again 300 divided by the number of the big box between the two RVs are the two only. Okay, so one big box, two big box, two big box only present between the two RVs, right? So that heart rate is now 150 beats per minute, right? So 150 beats per minute means what it indicates? It indicates tachycardia, right? So it's very important, bacho, how we have to say that it's a tachycardia. We have to check the number of the big box between the two RVs and take that one as a denominator and divide the number 300 by that number. So it will give the heart rate. So based on the heart rate, we can interpret this one, right? So one basic thing to remember, that is, if the more gap, between the two R waves, that means it's a bradycardia. If there is very less gap between the two R waves, that means there is a tachycardia. This is how we have to immediately capture after watching the ECG paper. But still, if you want to give a best answer in the exam, calculate and give. That is important for you all. Okay, it's very LKG UKG level calculation. Okay, just knowing the thing and applying the thing is important here, right? So look at this one. Yes, it's the normal sinus rhythm. The heart rate will 60 to 100. Okay, 1, 2, 3, and 4. So total number of the big box between the two RVs are 4. Okay, so I am dividing 300 divided by 4. The answer will be 75. Okay, 75 means it is between the 60 to 100. So it's normal, means it's what we call as the normal sinus rhythm. Okay, it is what we call as the normal sinus rhythm. And look at the second image. 1, 2, 3, 4, 5, 6. There are 6 large boxes between the two RVs. Again, 300 divided by 6, 6 1 ja, 6 5 ja, it's 15. So heart rate is coming here as a 50. Okay, 50. So 50 means, yes, it is less than 60. So we call this one as the bradycardia. Okay, so if it is less than 60, we call this one as the bradycardia. Okay, so again count this one. 1, 2, 1, 2. Only two big boxes are there between the two RVs, right? So again 300 divided by 2, it's on 150, right? It's on 150. Okay, 150 means it's more than 100. So that is what we call as the tachycardia. So this is how you have to say by watching the ECG paper whether it is a sinus bradycardia, sinus tachycardia, or normal sinus rhythm. Okay, hope this is clear for you all, right? So now tell me, if heart rate is between the 100 to 150, what we can say that one? What we can say that one? If heart rate is between the 100 to 150, that is called as Yes, sinus tachycardia. Sinus tachycardia. If in case the heart rate is between 150 to 250, so what we can say this one? Yes, we can say this one as in the paroxysmal tachycardia. So why this is paroxysmal? Because it is this kind of the tachycardia will rises suddenly and for short duration. Okay, and the response best for the treatment, right? So that is what we call as the paroxysmal tachycardia. If in case the heart rate is between 250 to 350, we call this one as the flutter. We call this one as the flutter. If in case the heart rate is, which is crossing more than 350, we call this one as the fibrillation. Okay, so in fibrillation, the heart will not contract. In fibrillation, the heart will only shake. It will not contract, and sometimes we are unable to assess the pulse rate. Unable to assess pulse rate in the fibrillation. It's important. Bacho, in many books, you will get the many different reading, and this is the standard reading all people have to follow for the clearing your aims. Right? 100 to 150 is the sinus tachycardia, 150 to 250 is the paroxysmal tachycardia, 250 to 350 is the flutter, and more than 350 and shaking of the heart only is the fibrillation. So it is a very basic thing all people have to know. And this is the classification of the bradycardia, right? Yes, the heart rate, normal heart rate, all people know that in the adult it's in 60 to 100 beats per minute. So this is the normal heart rate. If in case the heart rate is less than 60, so that is what you call as the bradycardia. If the heart rate is less than 60, we call this one as the bradycardia, right? If in case the heart rate is between the 40 to 60, means we call this one as in the mild bradycardia. What we can say this one as in the mild bradycardia. If in case the heart rate is between the 20 to 40, this is what we call as the moderate bradycardia. If heart rate is less than 20, that is what we call as the severe bradycardia. In the mild bradycardia, just wait and watch where the normal improvement can happen. But in the moderate and severe bradycardia, if it is asymptomatic, start the injection atropine. Okay, if it, the adult patient with a severe and moderate bradycardia, the drug of choice is atropine. Drug of choice is atropine for the moderate and severe bradycardia in adults. Okay, the drug of choice for bradycardia in children is epinephrine. Injection epinephrine, or we can say the injection adrenaline, both are same, right? Epinephrine and adrenaline, ಎರಡು ಒಂದೇ. Okay, so question ಬಹಳ simple ಇದೆ. The question is very much simple. The drug of choice for bradycardia in adults is the atropine sulfate, and the drug of choice for bradycardia in children is the injection adrenaline or the epinephrine. It's important. And sometimes the questions may throw in a such a way that, so what is the heart rate in the severe bradycardia? And you people will not notice the word severe. Okay, and you people will directly choose it is less than 60. Okay, so severe bradycardia means it is the heart rate is less than 20. You people have to choose the answer. Okay, so this is very important. Clear, bacho? So here is the next important question. So I want your answer in the comment box. Fatafat do comment for this session. Yes, while are watching the video live, so please hit the like button also. And if you are watching this one first time, so please do subscribe to the channel also. Okay. Yes, this one will strike in your next again in your prelims exams. Okay, which of the following is the correct placement of V1 chest lead in the 12 lead ECG? So V1 chest lead is the V1 is the our chest lead. I have told this one in the first video. Okay, V1 is the chest plate, right? Where we have to place this one. Option is telling fourth intercostal space left side of the sternum. Fourth intercostal space left side of the sternum. We can place. Yes, which one? The correct answer is fourth intercostal space right side of the sternum is the correct answer. So here we have to place the V1 chest plate. Okay. Now tell me where we have to check the V2 plus plate, V2 chest plate. Yes. Among the given option, tell me the placement, the correct placement of the V2 chest plate. Yes, that is the correct answer. V2 chest plate is the fourth intercostal space left side of the sternum. Okay, so only one chest plate where we have to assess the right side. So that is the V1. Okay, and rest all the chest plates. Total 6 chest plates are there. Among 6 chest plates, only one chest plate will come the right side. That is the V1 and V2, V3, V4, V5, V6. So these 5 chest plates which will comes to the left side of the our chest. Okay, so it's very important. Then the first option A is telling intercostal space fourth and left side of the sternum. That is the V2 correct placement. Option C is telling the fifth intercostal space left mid clavicular line. Right? In the fifth intercostal space and to the mid clavicular line where we have to apply this one. That is the V4. V4 chest plate placement is the mid clavicular line, fifth intercostal space. Very important. Then the option D telling fifth intercostal space left anterior axillary line. Yes, left side anterior axillary line in the fifth intercostal space. We have to place the fifth or we can say V5 chest plate. Okay, so that is the V5 chest plate we have to space. Then V6 where sir? Again in the fifth intercostal space in the mid axillary line. Okay, so bacho I am using the repeatedly one word, that is the intercostal space, intercostal space, intercostal space. What it is exactly? The intercostal space is the space between the two ribs. Okay, so the word itself it is telling it is the inter, means it's between something. Costal means the ribs. Between the costal or we can say between the ribs, the place is there. So this place, what we can say the intercostal space, right? Clear, bachon? Clear, the intercostal space is the place between the two ribs. That is what we call the intercostal space. So come to here. So the chest lid placement, very importantly, where we have applied the V1. Okay, look at this one. 1, 2, 3, 4. Okay, it's the fourth intercostal space. Okay, this one is the fourth intercostal space, and this is the sternum. This is the xiphoid process of the sternum. This is the body of the sternum, and this one is the manubrium of the sternum. Okay, so this is the right part of the sternum, and this one is the left part of the sternum. Or we can say this is the right border of the sternum. This one is the left border of the sternum. It's important. So only one lead I told we have to apply to the right side. That is the V1 chest lead. Okay. So here we applied this one, fourth intercostal space towards the right sternal border. Okay. Fourth intercostal space towards the right sternal border. And V2 we have told again the fourth intercostal space towards the left sternal border. Towards the left sternal border. Then directly after applying V2, we have to go for the our V4. Okay. So here we have to apply V4. This is the clavicular bone, right? So in just middle of the clavicle. Okay. So this is the half of the clavicle, and this one is the half of the clavicle. So this is the middle of the clavicle. So this is what we call as the mid clavicular line, fifth intercostal space, right? So this one is the fifth intercostal space here, right? So 1, 2, 3, 4, and 5. So this is the fifth intercostal space, mid clavicular line. We have to apply the V4. Then again, this one is the anterior axillary line, V5. Okay, and again it's a mid axillary line, V6. That's the left side, left side, left side, left side for all leads, and only one lead, that is the V1 is the right side. Okay, fourth intercostal space, right sternal border is the V1. Okay, Rest all are the left side only. Okay, it's very very important. And I told directly applying V1, we have to go for the V2, and after applying V2, we have to go for the V4 directly, and here we have to apply V3, means it is between V2 and V4. We have to apply V3. Okay, so we have to apply V3. Very, very importantly, the examiner's hard question where we have to apply the V3. It is between the V2 and V4. Wherever you want to apply, it should be between the V2 and V4. Right. So this is the important thing, and the examiner's very, very hot topic, repeatedly striking in the exam as a practical based questions in your prelims, right? So it's important. Bacho, focus here. The first lead only we are starting for the fourth intercostal space, that is the V1. Right side and left side also the first lead only we are starting from the fourth intercostal space. But sometimes the questions will ask related to this, okay? Where we have to auscultate the aortic valve sound. The aortic valve sound means sometimes the question will ask related to the auscultation area of the heart sound, where the mitral heart sound, the tricuspid heart sound, the Erb's heart sound, the Gibson heart sound, the aortic heart sound, and pulmonic heart sound will be there. Okay, so the area of this particular auscultation of the heart sound also will be asked in the exam. It's important. Okay, so the question is like, where is the best place to auscultate the aortic valve sound? Okay, directly the students will go for the V4 and they become confused. So don't confuse bachcho. Here in the auscultation, it will starts with the second intercostal space. It starts with the second intercostal space. Sir, how I have to remember? This is the A. Okay. So in the A, how many lines? One lines and two lines. Okay. So this is the A. So here auscultation starts with the second intercostal space. If people can remember like this. Okay. So look at the image here. The aortic heart sound. Only one heart sound we will get at the right side of the body, that is the aortic heart sound. Okay, so that is the what we call the aortic heart sound. Where we have to see the aortic heart sound, it's a sternal border, right side, second intercostal space. Okay, second intercostal space, right sternal border, where we have to see the aortic heart sound. It is important, bacho, very very important. And only one heart sound we can see right side, rest all will be the left side only. Okay, so come to this side where we have to see the pulmonic heart sound, that is again the second intercostal space but the left side of the sternum. Okay, so to the left side of the sternum we have to see the pulmonic heart sound. Sir, where will we see the Erb's point? It's on third intercostal space, same left side sternal border. Okay, so left side sternal border, third intercostal space is the Erb's heart sound. Okay, this one, third intercostal space, left sternal border. Sir, where I have to see the tricuspid heart sound? It's very simple. It's the fourth intercostal space, left sternal border. Okay, it's the fourth intercostal space, left sternal border. Right, sir, where I have to see the very very important mitral valve heart sound? This one is very important. It's a fifth intercostal space. Okay, medial to the midclavicular line. Right, so we can say the fifth intercostal space, we can say the medial, not lateral, just medial or at the midclavicular line also we can say. Very very important. So among all this, all people have to remember this one is a very important, the mitral heart sound. It should be heard at the fifth intercostal space. Fifth intercostal space. Very, very importantly, where in the fifth intercostal space at the mid clavicular line. Okay. So which side? Left side. So this will be very important for your mitral valve heart sound. And this entire thing is, I am giving the 10 star for this one because it is very, very important. And you people will confuse between the chest lead application and the auscultation of the heart sound. Okay, so remember the auscultation of the heart sound will start with the second intercostal space, right? Auscultation will start with the second intercostal space, and application of the chest lead which will start with the fourth intercostal space. This is enough to remember and give the best shot in the exams, right? So the question is like this here: the auscultation of the aortic heart sound, where we have to see the aortic valve sound. Yes, here the fourth intercostal. No, this is not. Sorry. Here the second intercostal space, right side of the sternal border. Okay, so right side of the sternal border. Sorry, right. So this one is important. So the answer is there. That is the second intercostal space, right side of the sternal border is the correct answer. Okay. So option B, fifth intercostal space, left mid clavicular line. This is which one we have to assess? That is the fifth intercostal space, left mid clavicular line. Yes, that is the our mitral. Very, very important one. Just I have discussed. This is the mitral sound where we have to auscult. Then second intercostal space, left side of the sternal border, where we have to assess the pulmonic heart sound, right? Then fourth intercostal space, left sternal border. This is also very, very important, where we have to assess the tricuspid. Tricuspid. Okay. So hope we have cleared this one with a clear image also, right? So why I have told this one in the ECG, because you people will get confused in the exam. So I am comparing and giving a clue, means you people will won't confuse in the exams, right? So here is the next question, and very, very important questions. So do read the question completely carefully, then try to give the best answer for this one. Right? Which lead? The question is very simple. Which lead presents between the right arm and the left arm in the enthovine triangle? Yes, in the enthovine triangle. So which standard lead is present between the right arm and left arm? Bacho, yesterday only I have told who is Anthony. William Anthony is the, yes, father of the ECG, right? So on his name, there is one triangle. We call that one as the Anthony triangle. Okay. So anyone wants to answer for this one? Yes, very nice. Okay, who all are answering? Option A is the correct answer. That is the correct answer. Okay. So let us see how it is correct answer. Bacho, look at this one. He's a person. I will take his arms like this. Okay. So it will be very much clear for everyone. Okay. This one is the right arm. This is the left arm. Right. So this is the left foot and this is the right foot. Right. So the triangle will be comes like this. From the right arm to the left arm. Let me change the pen color. Okay. From the left arm to the right arm. From here, it will comes to the left side foot directly. Okay, it will comes to the left side foot. Okay, from here it will runs towards the left side arm. Okay, yesterday only I have told this black color one, the right leg is neutral. We will not consider this one. Okay, in the yesterday's first only I have told the black color one or the right leg is the neutral one, and we will not consider this one in the count, right? So this one, so lead we are applying to the right arm, we call this one in the augmented vector right, and the lead which are applying for the left arm, we call this one as the augmented vector left. Okay, so the lead we have applied for the left foot, we call this one as the augmented vector foot. Okay, so there are three leads, right? The one standard lead present between the augmented vector left arm and right arm. Okay, so the first standard lead is present between the, it's an imaginary lead of the bipolar. Okay, so that is present between the left arm and right arm. That is the standard lead first. So then the standard lead second will be here. you have to come as an anti-clockwise direction, not clockwise. Okay, so you have to come as this direction here, right? The first standard lead is between the augmented vector left and right, or we can say between the left arm or the right arm, and the second chest lead is between the right arm and left foot. Okay, it is between the right arm and left foot. And the third chest lead, sorry, third standard lead, standard lead, which is present between the left leg and our left arm. Okay, this one will strike in the exam. Okay, what is the examiner asked a question here? He have asked a question in the William Enthoven triangle. So this one, this triangle we call as the William Enthoven triangle. Okay, let me try it again here. So this is augmented vector right, augmented vector foot left. Okay, and here the augmented vector foot, and the triangle will be like this. Okay, so here will be the standard lead first, standard lead second, and the standard lead third. Okay, so in between the right arm and left arm, which standard lead is there? Between the left arm and the right arm, first standard will be there. Between the right arm and left foot, second standard lead will be there. Between the our left foot and left arm, third standard lead will be there. Okay, so it's important. Okay, so is that clear, bacho? I hope the William Enthoven triangle is clear. And here the negative pole, positive pole, it will come. That is not important as of now. I will teach that one while teaching the entire complete description of the theory. Okay, so don't worry about that one, right? So here is the next question for you all. So take this question as a 100-star important question. Fix one question will throw from here. Okay, the lead importance and the area of the myocardial infarction. Okay, so that is very important. What from where we have to assess the abnormality from the inferior wall MI, from the superior wall MI, from the septal MI, from the anterior wall MI, okay, from the lateral wall MI, from the posterior wall MI. Means it's very simple. But the question is here, which of the following leads on the ECG most commonly show ST segment elevation in inferior wall MI? Okay, in inferior wall MI. So it's very important. Lead V1 and V2, it will show the MI in the septum. Okay, septum. If in case any myocardial infarction and any kind of the damage to the septum, what is the septum? Septum is the what we can division between the two atrium and two ventricles. Okay, so this is the right atrium, this is the left atrium. In between this wall, or we can say this barrier, so this is what we call as the atrial septum, right? So this is the right ventricle, this is the left ventricle. So in this between this right ventricle and left ventricle, this barrier, so we call this one as the ventricular septum. If in case any damage to the septum, so the changes will comes in the lead 1 and lead 2, that is the septal wall MI, we can say, right? So then if in case any infarction which is coming between the V3 and V4, okay, any MI damages which is coming between the V3 and V4, so we call this one as in the anterior wall MI. Okay, we can say the anterior wall MI, very important. Okay, if in case the problem which is arising between the lead second, third, and augmented vector foot, standard lead second, standard lead third, and augmented vector foot. So this one which indicates the inferior wall MI. Okay, inferior wall MI, right? Very important. So the next point is the lead 5, V5 and V6, which indicates the lateral wall MI. And this one augmented vector right, or we can say AVR, which indicates the posterior wall MI, which indicates the posterior wall MI. Very important. Okay, so many times the question asked related to the inferior wall mi, remember this one. Sir, how to remember that one? As I told, in the William Anthony triangle, so this is the inferior part, right? Superior means above, inferior means below. So look at the inferior part of the triangle, standard lead second, standard lead third, and augmented vector foot. Okay, so place our heart here. Okay, so place our heart here like this. So this is the inferior part of the heart. This I am going to color with the pink one. So this is the inferior part of the heart and this is the superior part of the heart, right? So if any damage to the inferior wall, so we can say the inferior wall mi, the standard lead second, standard lead third, and augmented vector foot is going to be affected, right? So that's the very important one. Clear, bachcho? So look at the answer here. Here is our question here. Okay. So the question is here. The inferior wall mi means standard lead second. Yes. Standard lead second is there. Then standard lead third. Then standard lead third is there. Yes, sir. And the standard lead, sorry, augmented vector foot is there. So the augmented vector foot will be here in our option. So which indicates clearly the inferior wall mi. So it is important and very important. Okay. So let me quickly revise this one again, bachcho, because it is very important. V1, V2, which indicates the subtle mi. V3, V4, anterior wall mi. Augmented vector second, third, and augmented vector foot, inferior wall mi. So then V5, V6, lateral wall mi. Then augmented vector right. So that is the right arm, which indicates the posterior wall mi. So it is very important. Okay, so whatever the thing we have discussed with today is the most important, but it will strike in your exams definitely. Okay, so let me clear this question also for you all. Okay, so yes, just a second, please. Okay, yes. So what is the normal duration of the P wave on ECG? What have we have told? The normal duration of the P wave on ECG. So as I told, bachcho, the P wave is the first wave. Okay, so this is the P wave. Okay, this is the first wave in the ECG is the P wave. It happens because of the atrial contraction, or we can say the atrial depolarization, or due to the atrial systole. Okay, so if any problems with the atrium, so we have to watch with the P wave, right? So this P wave's height we can say, or amplitude also we can say. So it will be 1 mm, or we can say 0.1 millivolt. Okay, so this is the amplitude or the height of the one small box or one P wave, because so the height of the P wave is restricted to the one small box only. Okay, but the question asked is the duration, means the time taken by the P waves. Yes, so this P wave, it will happens in the 2 to 3 small box. I will give the clue to you people. So that give the correct answer. The P wave duration, it will happens in the 2 to 3 small box. Okay. So give me the answer for this one. What is the duration of the P wave? Yes. As all of you know that many times we have studied, one small box duration is 0.04 second. So this is the duration of the one small box, right? So the duration of the one small box is the 0.04 second, means here I am telling the P wave takes 2 to 3 small box. Okay, multiply that one, 0.04 into 2, that is 0.08 second. Okay, so multiply it with 3, again 0.04 into 3, that is 0.12 second. Okay, so the duration of the P wave is between the 0.08 to 0.12 second, and our option A is the correct answer here. But if in case the examiner wants to ask the one from this reading, means he will throw the questions like this. What is the minimum duration? What is the minimum duration? means your answer would be 0.08. And if in case the examiner asking what is the maximum duration, means your answer would be the 0.12 second. Okay, if it is going more than 0.12 second, we call this one the prolonged P wave. Okay, it will be seen in the some atrial related problems. I will discuss that one in detail. Okay, so don't worry about that one. Okay, so remember the answer. If the examiner is asking the question, the minimum duration, that is the 0.08 second, and the maximum duration of the P wave, that is the 0.12 second. Okay, so not only the P wave, okay, just we have discussed this one. Normal amplitude of the P wave is the 0.1 millivolt or 1 mm, okay, or 1 mm, okay, and the normal duration of the P wave is the between the 0.08 to 0.12 second. Okay, it's important. So these 2 points are very very important. Okay, so not only P wave, I will give a clue to go for the other three things. So that is generating between the 2 to 3 small box. Okay, that is the first one is the P wave. It will take 2 to 3 small box to get form. Okay, then next one is the QRS complex, or we can say QRS interval. QRS interval. So this is also forms in the 2 to 3 small box. And the next one is the, yes, that is the PR, sorry, segment, not interval. It's a pair segment will also will be there, and pair interval also will be there. So here the pair interval, sorry, segment. Let me write it again. Okay, P wave, one interval and one segment. How to remember? One wave, one interval, one segment. Which wave? That is the P wave. Which segment? That is the pair segment. And which interval? That is the QRS interval or which QRS complex. So this one, these all three will form in the 2 to 3 small box. If the examiner throwing the question in front of you, okay, what is the normal duration of the QRS complex? You can say the same and one answer, that is the 0.08 to 0.12 second. If they want to ask the minimum, give the 0.08, maximum 0.12 second. Okay, so it's important. If they want to ask the P wave, again same answer. QRS duration, same answer. QRS interval, same answer, and pair segment also same answer. Very very important. These three people have to remember here. Okay, right? It's very very important. Okay, so this is all basic thing we have learned about the normal P wave and its all the duration, amplitude. Okay, so in the tomorrow class we will discuss the pathology related to the P wave. Okay, so that is what is P pulmonale, what is P mitrale, what happens in the right atrial enlargement, what happens in the left atrial enlargement. Everything we will discuss in the tomorrow's class. So stay connected, stay tuned. So we'll meet again in the tomorrow's class. Tab tak ke liye Jai Hind, Jai Bharat. We will meet again. And one more important announcement for you all. So as all of you know that we are having a branded master nursing classes app. So where we are having the free Sunday test every Sunday. Okay, free Sunday test. It's the same pattern. It's the same pattern like NORCET 8. Like NORCET 8. Bacho, same to same thing you people will experience where the 18 minutes 20 question session, and most importantly, so this is free every Sunday, and the reward also will be there. The rewards, what is the rewards for the top 3 students? 75% flat discount on the test series. Okay, sorry, top first all India rank 1 students 75%, all India rank 2 students 50%, on all India rank 3 students 25% flat discount on the our test series, and top 25 students, 10% extra discount will be given on our NORCET 8 master test series, where it is prepared by the expert nursing officer, where it is prepared by the prepared and reviewed by the very excellent officers, where already they have cracked 8 to 10 exams in the central government. Okay, so they themselves they are giving the time and they are preparing the questions which are very important. So they know, and even I know what the examiner will ask the questions to your people. So we are practicing the same situations, same scenarios, same questions with the same options. So don't forget to join to our test series. So it's free for everyone. Okay, and very affordable price we have kept. So plus once you people have to download the master nursing classes, I have given the link in the description box. Okay, so then try to give the every Sunday free test. And if you are interested and you truly want to crack the NORCET 8 exams, so take subscription of the our master nursing classes test series. It is going to be very beneficial, bacho. Again, after the NORCET 8 exams, I will come with a screenshot that the questions which are came in the NORCET 8 is from our test series. Okay, so this is an important announcement for you all. So we'll meet in the next class. तब तक के लिए जय हिंद, जय भारत.